Hi, my name is Crystal May Vallester, a first-year student of Bachelor of Science in Nursing, and today I will going to demonstrate a complete bed bath. As to every procedure, first knock at the door of your patient's room and greet your patient. Good morning, Mrs. J. Check the name tag of your patient to ensure correct patient. My name is Crystal May Vallester, and today I will be assisting you in your bed bath this morning. So I understand that you're not able to get up this bed, so that's completely fine. So I will do the procedure here at the comfort of your bed, and you don't have to do anything. So I will lock up your door to provide you some privacy, and of course to pull your curtain to provide you comfort throughout the procedure. So I have here all my equipments for the procedure that I will be doing. So it is to ensure or to have an easy access of these equipments, and to avoid leaving the patients while retrieving all the missing equipment. So I have here some blanket, some bath towel, a toothbrush, a lotion, a hair conditioner, a shampoo, a deodorant, a new clean patient's gown, a bath face towel, 2 basin with water in it, a warm water in it, a brush, a nail file, and of course, alcohol to sanitize my hands, and a new clean gloves to which I will be using throughout the procedure. So first, before performing the procedure, I will perform hand hygiene and use clean new gloves. So this will ensure to prevent the spreading of microorganisms. So now, I will offer Miss Jade a bedpan or urinal. So instead of using the actual bedpan, I have here a pillow instead. So Miss Jade, I will help you get on the bedpan or the urinal to prevent interruption of the other procedure in bathing. Is that okay with you? With my hands gloves on, raise the bed in working area, lower the side rail, and assist the patient in a comfortable position. So this will help me reach my patient without reaching or stretching, and thus minimizing back pain. Folding the sheet to expose the lower portion of the body. So Miss Jade, please bend your knees and your feet flat on the bed. So I have here a waterproof pad, which I will be inserting beneath her hips. So Mrs. J, can you please raise your hips so that I can insert this pad. This will prevent soiling of the bed. Same goes in inserting with the urinal pan or the bed pan. Again, Mrs. J. Then, put down the sheet in order to provide comfort and warmth to the patient. So I will raise the head of the bed into 90 degrees and then raise the knees of the bed so that it will give more comfortable feeling to Mrs. J. So how does it feel, Mrs. J?
It's fine.
Alright. Thank you. So I have here your call light. So you can push this call light when you're done. And also this call light will help the patient be directed or be connected to the nurse in times of need. So I will take off my gloves and put this in the garbage bag. Wash my hands to prevent the spread of microorganisms. So were you done, Mrs. J?
Yes.
So now I will put another clean gloves. Lower the bed in flat position. Folding again the sheet to expose the lower portion of the body. Again, Mrs. Jade, please bend your knees and your feet flat on the bed and your hips up. So immediately put this bedpan or urinal pan into the comfort room to clean and sanitize. Now, I will ask Mrs. J to turn to her side position. Get my warm cloth and wash her perineum from front to back. Put this cloth into the hamper. Then pack the pad under her hips so that he cannot roll into anything. Assist Mrs. J to get back into supine position. Cover her lower portion. This will provide comfort and warmth to Mrs. Jane. So after all of that, I'm gonna take off my gloves again. Wash my hands to free from microorganisms. So the next procedure that I will be demonstrating is the oral hygiene of my patient. So, I will first sanitize my hand. This will prevent and reduce the spread of microorganisms. Put my gloves on. Next, arrange supplies in the bedside table within reach. So this will prevent interruption while doing the procedure. And of course, to have an easy access with all the equipments needed. Now, raise the patient bed in a comfort position or in comfort height. Then raise the head of the bed. So consider this. It is already in raised position. Then assist the patient in comfort of her position. Place a bath towel over patient's chest. So this will prevent her shoulder area from getting wet. So next, I will be giving Mrs. Jade a sip to moisten her mouth. Next, I will be putting a toothpaste on the toothbrush. So in brushing her teeth, I use front to back motion. Front to back motion in brushing the outside surface of the teeth, the chewing surface of the teeth, and the inside of the teeth. Then, in brushing her tongue, I'll make sure to have a front and back motion. Then, go back to the outside surface of the teeth and have the upside down. Then next, I will offer my patient an emission basin she will spit on. Water where she can swish and spit again to remove the extra toothpaste. So next, I will offer my patient a dental floss 18 inches long. So as if I have here a dental floss So this dental floss will remove extra cavity in between the teeth of the patient. Then I will offer my patient again the water and spit. So next, I will offer my patient a mouthwash. So consider it is a mouthwash. So I will put 1 part of mouthwash, then 3 parts of water. So I will give this to my patient. And allow her to rinse for approximately 30 seconds, and then let my patient spit it. So I will use the corner of my blanket to dry off my patient's mouth. And lastly, I will offer my patient a lip balm when she's not on oxygen. So this lip balm will moisturize the lips of my patient. After all of that, I will remove my bath towel, then put it in my hamper, then side roll up, put the bed in low position, then remove my gloves, sanitize my hands, and we're done with the oral hygiene. So the next procedure is I will be putting a bath blanket over the patient's body. Then, lower the top sheet, making sure to give privacy to the patient. Put this soiled top sheet into my hamper. So this bath blanket will give privacy and warmth to the patient to the remaining procedure. So after putting a bath blanket over my patient's body, I will remove my patient's gown. So unsnap the sleeves of my patient's gown, for this will provide full range exposure of the body over the bath procedure. So first, let's start removing gown from the unaffected side. Then to the affected area. So this will allow easier manipulation of the gown over the patient's body with reduced ROM. So for the next procedure, I have here all the necessary equipments which I will be using for washing my patient's face and eyes. So as usual, we should sanitize our hands first to prevent microorganisms. So next, I will raise the side rail, raise the bed at the appropriate or comfort height. Then I will let my patient check the water. Please, ma'am. So, raising and lowering side rails will help or ensure patient safety. And checking water or warm water gives relaxation to the muscle of my patient, gives extra comfort, and of course, to prevent chilling. So now, I will ask my patient which is more comfortable for her. Is it with or without pillow?
With pillow.
Alright, Mrs. J. So now, I will place a towel under my patient's head and shoulder. This will prevent the pillow and the bed from soiling. Then, I will place a bath towel over my patient's chest. For this will give extra privacy, comfort, and relaxation to my patient, and of course, from getting wet. So ma'am, do you have any contact lenses?
No.
So asking this question to the patient will help us prevent unnecessary injury to the eyes. So now I will be getting my washcloth and rinse it over into my basin. Then I will form a simple mitt. Then start washing my client's face from the inner eye, then working away. So washing the inner eye to the outside will prevent secretion from entering to the lacrimal duct. So same procedure with the other side. Start from the inner, then go away or working away. So we can get rid of the used face towel. So since we don't have much towel at this moment, so consider it as clean towel. So I will moist this towel and rinse it over at my basin. Then form mitt, simple mitt, then wash the face. Use the other corner. Don't forget to wash the beneath of the ear or the under ear. The under of the ear. And of course, don't forget to wash the neck. So since our patient did not want to put some soap on her face, so there is no cause for rinsing. So we just need to take our towel and pat our patient's face dry. Don't forget to dry the ear or behind ear, the neck, to prevent accumulation of microorganisms. So after washing the face of my clients, let's proceed in washing the upper extremities of my client. So instead of washing first the chest area, so I'm gonna wash my patient's arm. So I will gonna remove this. And place this under my patient's arm. This is to prevent my bed from soiling. So again, I will get my washcloth, rinse it over my basin, then I will put some soap, then rub it on, then I will start from the hand. So I have here a small basin with warm water in it so that Mrs. J can soak her arm. So this feels really good. So this gives more relaxation to Mrs. J. So I will soak her hands in a few minutes, then I will take it back. So I'm gonna continue washing her hands, saving the axillary part or the arm free last. So the soap lowers tension and removal of debris and bacteria when friction is applied during washing. So then to the axillary. Then dry it up. So apply the same procedure to the other side. So after washing her hands, I will start washing the chest area of my patient. So again, I will be getting my washcloth, rinse it over, same procedure, apply some soap. So while shielding my patient, I will wash her chest. So shielding will provide privacy to my patient and of course give comfort for her. So if your patient is female, so make sure to wash her under breast. Same procedure with the arm. Dry it up. So now let's proceed in washing the abdomen area of my patient. So let's just fold this in half to cover the private part of the patient's body. Then same goes with the bath blanket. Fold this in half just above the pubic area. So same thing with washing the chest area. Rinse it, dry it. So just like that. So we're gonna put it back after drying. And the bath towel over. So after all of that, I will get this bath towel and placing it here. So after that, I will check my water's temperature. So if it's getting colder, then I will replace it with warm water. So after washing the upper extremities, let's now proceed washing the lower extremities of the patient. So just like what we did in the arm, expose the other side of the leg. Just at this point so that we can still provide privacy to our patient. Then put a pad under to prevent the bed from swaying. So if our patient is able to soak her foot, then that patient soak her foot for about a few minutes. Then after that, get that out. So same goes with the other procedure in washing. So I will get my washcloth, rinse it over, put some soap in it, then rub it. So make sure to wash the feet in order to free from bacteria and all other microorganisms. So we can use long stroke in washing our patient's feet. So in washing the foot of our patient, we made sure to clean in between toes of our patient to remove all the piled dirt in between. So earlier, we're done with the soaking of the foot of our patient. So now, let's clean her nails. So let's brush the nail, file it, just gentle as possible. We should avoid cutting nails, especially those patients who are a diabetic patient. Then, same procedure with the other side of the leg. After that, we should dry the feet of our patient or the foot of our patient. Dry it up. So in raising the foot of our patient, we should place our hand under the knees and assist. So same goes with the other side. I will get out this bag. Put it in my hamper. Then cover the foot of my patient. So now let's proceed to the washing the back of the buttocks of our patient. So now, I will assess my patient to bend her knees. And in the count of 3, I will push my patient into a side-lying position. So 1, 2, 3. I will place a towel in a lengthwise position. This will prevent the bed from soiling and contamination. So same goes with the other procedure. I'll get my washcloth, rinse it over, put some soap in it, rub it. So I will going to wash first the back of my patient, then the bottom. So wash it carefully and thoroughly. Then dry it out. Then next, apply or wash. In washing the buttocks, same thing, apply some soap, rub it, and then, so in cleaning or washing the buttocks of our patient, it should be from front to back. Like that. To the other corner. So that the bacteria will not come in and out. Then, same goes, dry it up. You can just pat it up. So, our patient is all dry, so it is the best time to put some lotion in it and do some massage. So I will put some lotion and put it on the back of my patient. So I can start massaging from the spinal, then down, then up. So massaging the back of our patient give them a relaxation. So once we're done, so I will get this towel and put it in the hamper and place our patient into supine position. That's it. So now let's proceed to the perineal care. So first and foremost, I'm going to wash my hands, sanitize it of course, and use or put on my gloves. So once I have my gloves on, so I will now proceed to the procedure. So I will tell her to cross her right arm over left, then same goes with their leg, the right leg over left. Then in the count of 3, I will push her to her other side position. Then I will place a waterproof pad under her buttocks to prevent our bed from soiling. Then drape the patient with appropriate blanket. So in that way, it ensures the patient exposure and provide additional warmth to our patient. So after placing the waterproof pad, then assist the patient into a supine position. Fold lower corner of the bath blanket up between patient's leg and toe abdomen. So make sure that the patient is now in dorsal recumbent position in order to expose the perineum. So wash labia majora. Use non-dominant hand to gently retract labia from thigh. Then with dominant hand, wash carefully in skin folds. Wipe in direction from perineum to rectum. Other folds. Then repeat on the opposite side with separate section of washcloth. Wiping from front to back reduces chance of transmitting fecal organisms to urinary hiatus. Then next, gently separate the labia with non-dominant hand to expose urethral hiatus and vaginal orifice. With non-dominant hand, wash downward from pubic area downward to the rectum in a smooth stroke. Wash the middle line of both sides of the perineum. Use separate section of cloth for each stroke. So avoid placing tension or indwelling catheter if present, and clean area around it thoroughly. So cleansing method reduces microorganisms to transfer to urinary hiatus. For menstruating women or patients with catheter, so indwelling catheters, so we can clean them with the use of cotton balls. So rinse area thoroughly and dry thoroughly from front to back. So rinsing can remove microorganisms and soap effectively than wiping. So fold lower corner of the bath blanket back into the leg of the patient and over the perineum. Then ask patient to lower leg and assume to comfortable position. So in male patient, apply the same procedure just like what I did last in the female procedure. Then to expose their perineum. So assuming this is the penis, so gently raise the penis and place a bath towel underneath. So gently grasp shaft of the penis. So if patient is uncircumcised, then retract foreskin. So if patient has an erection, then defer procedure until later. Gentle but firm handling of the penis reduces the chance of erection. So wash tip of the penis at urethral meatus first. So using circular motion, cleanse from meatus outward. So discard washcloth and repeat with clean cloth until penis is clean. So rinse and dry gently. So direction of cleaning moves from an area of least contamination to an area of most contamination will prevent the microorganisms to enter the urethra. So return foreskin to its natural position. So this is extremely important in patients with decreased sensation in their lower extremities. So gently clean shaft of penis and scrotum. So assuming this is the scrotum here, so lift the scrotum carefully and wash underlying skin folds. Then rinse and dry thoroughly. So move back the patient into his comfortable position and put the blanket along with his legs to provide warmth and comfort for the patient. So after the perineal care, of course, remove your gloves and put it in the trash bin. Then sanitize your hand. So we're almost done with our bed bath. So now let's proceed to our hair care and shampooing. So first, I will sanitize my hand again for this procedure. So assuming this is a shampoo board, so I will place this shampoo board under my patient's head and a wash basin under end of the spout. So this is to avoid water spillage during the shampooing and of course to get rid of wetting the patient. So I will place a towel under my patient's neck and a bath towel over her chest. So next is we should brush and comb our patient's hair. This is to free the hair from tangles and also prevent damage. So this time, I will ask my patient to hold a towel or a washcloth over her eyes. Okay? So this one is to prevent from irritation to the eyes, and it serves as protection. So I will test the temperature of the water and pour it into the patient's hair until completely wet. Then apply a small amount of shampoo. So work up ladder with both palms, starting from the hairline and work towards neck. So lifted head slightly to wash back of head. Then massage scalp by applying pressure with fingertips. So this is to give therapeutic feels and help dilate blood vessels beneath the skin. So after that, rinse the hair with water. So ensure that the water drained into the basin. Then repeat rinsing until it is free from soap. So now let's apply a conditioner or a cream if requested. So this is to give moisture and soften the hair of my patient, and of course to prevent breakage of the hair. Then rinse hair thoroughly. Then wrap the patient's head in bath towel. So wrapping the head and the hair of my patient, this will give the head and the hair warm after being bathed. So I will get this one, then dry all the wet area. So we can dry the scalp area of our patient using using other towels. Then comb the hair and apply hair dryer if necessary. So I will ask my patient if she wants me to style her hair or let her hair be like this. So are you gonna want me to style your hair, ma'am? Okay. So I'm done with your hair. So now we're at the last part of our bed bathing, and this is to give the patient a new clean gown. So I will raise the bed at the head of the bed. So assuming it is already in elevated position. So in dressing the patient, so let's start from the affected area. So we should put it slowly to avoid discomfort to the patient. So if there is present of an IV bag, then rehang the IV bag. Then proceed to the next area. Okay. Remove the back bracket. And put it in the hamper. Then place the top sheet. So after all the procedure had been done, so we should place all the gathered equipments into its proper places. So that concludes our bed bath. So thank you for watching.